Do you think NHS bodies, all NHS bodies, should have multi-year funding settlements?
We would always welcome, I don't know, I speak for colleagues across the NHS, as much certainty as possible, not just in revenue funding but capital as well.
The principle of looking sufficiently far ahead to give certainty. 5-year funding envelope to start with, but I think we would all agree having that workforce plan in place, commits subsequent governments, to taking account of it.
What are we going to do to ensure that mechanical thrombectomy is offered across England 24/7?
Well, that is one where we are making progress in some areas, but not in all areas. So in London, for instance, our ambition to achieve 10% of patients with thrombectomy is pretty much there, but in places like the east of England, it's not at the moment.
I just find the development of mechanical thrombectomy services across the country is a must.
We are completely focused on achieving the thrombectomy rates that we need for the population.
My concern is that innovation is often, supported through, one-off funds, or it depends on the particular interest of a clinician. It's iterative, often in devices, and so my concern is that quite often procurement leads and commissioners are making short-term decisions to save money in the short term, and that doesn't really give a saving in the longer term. There is a concern that transferring this down to the local level, you'll get more of that. Do you think that's a concern, or do you think that's ill-founded?
Not necessarily, and I think in some of the conditions we will be working on a lead commissioner, so it will not all be devolved to 42 commissioners. I think there are different models in how you can work this.
If you feel NHS England have been an effective commissioner, why are we changing specialised commissioning?
For instance, dialysis provision has been one of those areas, whether it should sit at local level or at a higher level, whether that's regional or national.
You're saying at the moment we don't have the balance right? We don't think you have the balance right at the moment?
At the moment, you are more likely to get access to specialist services if you happen to live near to a provider of specialised services. And so if you look at it on a population basis rather than a geographical basis, that can't be right.